Have you felt like your spark is fading, but no one's talking about it? That a part of your own body has started to feel less like you and more like a source of frustration? Maybe it's that third trip to the bathroom last night that broke your sleep, or that feeling of urgency followed by a weak stream that leaves you feeling like the job's not done. You find yourself quieter, more withdrawn, like you're slowly fading into the background. Have you ever felt like you're no longer yourself? Hello. Welcome to ElderCare Insights. I'm Dr. Alan Rivera. If any of what I just said resonates with you, I want you to know two things. You are not alone, and there is real, practical hope. Today, we're going to have a frank, honest conversation about the prostate. We're going to cut through the noise, the internet hype, and the miracle cures you see online. We're going to talk straight, man to man, about what's really happening in your body and what the actual science says you can do about it. This is where men like you learn the truth about aging and vitality with the dignity you deserve. Now, if this is a conversation you've been waiting to have, click that like button. Let me know in the comments. Have you felt like your body has changed in ways you didn't expect? Your honesty helps us all feel a little less alone in this. The garden hose problem. What is BPH really? All right, let's get right down to it. What is actually going on down there? When you were a young man, your prostate was about the size of a walnut. It did its job quietly in the background. But as the years go by, things change. Think of it like the foundation of a house built 50 years ago. Over decades, things settle, shift, and expand. Hormonal changes, a natural part of a man's life, cause the prostate to grow. For many of us, it can grow to the size of a lemon or even bigger. Now imagine a garden hose. Your urethra, the tube that carries urine out of your body, runs right through the middle of your prostate. When the prostate gets bigger, it starts to squeeze that tube, just like someone is stepping on the garden hose. That's what's causing the symptoms, the weak stream, the feeling that you can't fully empty your bladder, the sudden urgent need to go, and most frustratingly for many, getting up multiple times a night, wrecking your sleep and your energy for the next day. This condition has a medical name, benign prostatic hyperplasia, or BPH. Benign means it isn't cancer. Let me repeat that because it's critical. BPH is not cancer. They are two separate conditions, though sometimes their symptoms can feel similar. And it's incredibly common. About half of men between 51 and 60 are dealing with this. By the time you're 85, that number jumps to 90%. So if you're experiencing this, you're not an outlier. You're normal. But just because it's normal doesn't mean you have to suffer through it. The myth of the miracle fruit cure. Now, I'm sure you've been on the internet. You've seen the videos with bold, exciting headlines. Shrink your prostate in 18 hours with this one fruit, or the kiwi cure for BPH. They show you pictures of pomegranates, kiwis, and watermelons, promising a quick, easy fix. As someone who has spent decades studying men's health research, I need to give you the straight story. These claims are, to put it politely, a massive exaggeration. Let's break down the most common ones, separating the marketing hype from the real science. Pomegranate and blueberries, hope or hype? You'll hear a lot about pomegranate juice. There was a study at UCLA that found men who already had prostate cancer and drank pomegranate juice saw a slowing in how fast their PSA levels rose. This is interesting, yes, but two things are key here. One,
This was in men with cancer, not BPH. And 2, it didn't shrink the prostate or reverse the condition. It just slowed the progression of a marker for cancer. The compounds in pomegranates do show anti-inflammatory properties in a lab dish, but what happens in a test tube is a world away from what happens inside a 65-year-old man's body. The same goes for blueberries. They are full of powerful antioxidants. In a petri dish, scientists have shown these compounds can slow the growth of prostate cancer cells. But here's the reality check. There are 0 clinical trials in humans showing that a handful of blueberries will do anything to improve your BPH symptoms or shrink your prostate. It's a huge leap from a lab dish to your real-life health.
The so-called kiwi and watermelon cures. Yes, kiwi is packed with vitamin C, and watermelon contains some lycopene. Both are fine, healthy fruits to include in a balanced diet. But are they miracle cures? Absolutely not. There are simply no specific scientific studies that show either of these fruits can directly reduce prostate size or make you stop waking up at 3 a.m. It's just not there in the evidence. The reality check. Your prostate won't shrink in 18 hours. This might be the most important myth we need to bust. The claim that any food will shrink your prostate in 18 hours or even 7 days is pure fantasy. It has absolutely no basis in medical reality. Think about it this way. Your prostate didn't grow to the size of a lemon overnight. It was a slow, gradual process that took decades. It stands to reason that any real, lasting improvement will also take time. Even the most effective, powerful prescription medications for BPH, drugs designed specifically for this purpose, take months, not days, to show a significant effect on prostate size. So let's put the miracle cures aside and talk about what actually works based on solid, verifiable evidence. Part 1. The single most powerful food for your prostate. After all that debunking, you might think I'm going to tell you that food doesn't matter at all. That's not true. While no single fruit is a magic bullet, there is one food that stands head and shoulders above the rest in the research. It's not exotic. It's not expensive. It's the humble tomato. Of all the foods touted for prostate health, tomatoes and tomato products have the strongest and most consistent scientific backing. The reason is a powerful antioxidant called lycopene. It's the natural compound that gives tomatoes their rich red color. What does the science say? One key study found that men who consumed lycopene equivalent to about 2 cups of watermelon daily, tomatoes are even better source. For 6 months, not only saw their BPH symptoms improve, but they also prevented the prostate from getting any bigger. Now listen to this part. The control group, the men who didn't get the lycopene, saw their prostate size increase by 24% in that same time frame. This isn't a miracle, it's nourishment. You're not just eating a food, you're giving your body a tool it can use to fight inflammation and support cellular health. But here's the trick. This is the detail those viral videos always miss. You get far more power from cooked tomatoes than from raw ones. Cooking tomatoes, especially with a little bit of healthy fat like olive oil, breaks down the plant's cell walls and makes the lycopene up to 4 times more available for your body to absorb. So that rich marinara sauce on your whole wheat pasta or a warm bowl of tomato soup is actually doing you more good than a raw tomato in a salad.
This isn't just theory. Researchers are taking lycopene so seriously that there's a clinical trial right now testing if concentrated tomato paste can help men with prostate cancer. Again, that's for cancer, not BPH, but it shows you that this is an area of serious medical investigation. The takeaway is simple. Incorporate cooked tomato products into your diet regularly. It's a practical, evidence-based step you can take starting with your next meal. You're not just eating dinner. You're signaling to your body that you still matter. Part 2. Beyond Food. Proven medical strategies that work. A healthy diet is your foundation. But for many men, especially when symptoms are moderate to severe, diet alone isn't enough to get the quality of life you deserve back. This is where modern medicine offers real, effective solutions. Let me be clear. You do not have to just live with getting up 4 times a night. You do not have to accept a weak stream or that constant nagging feeling of needing to go. Proven treatments exist, and they are far more effective than any supplement or dietary fad. Let's walk through the main options your doctor might discuss with you. Option 1. The relax and flow medications, or alpha blockers. Think back to our garden hose analogy. The prostate is squeezing the urethra. One way to fix this is to get the pressure off the hose. That's exactly what alpha blockers do. Medications like tamsulosin, or Flomax, doxaciin, and terazosin don't actually shrink the prostate. Instead, they work by relaxing the smooth muscle cells around the neck of your bladder and within the prostate itself. By relaxing that grip, they open up the channel, taking the foot off the hose. The biggest advantage of these medications is that they work quickly. Many men start to feel relief, a stronger stream, less urgency, within a matter of days or weeks. For the man who is deeply frustrated and losing sleep, this can feel like a godsend. It's a direct, effective way to manage the symptoms. Option 2. The shrinking medications, or 5-alpha reductase inhibitors. While alpha blockers just relax the muscle, this next class of drugs gets to the root cause of the growth. Medications like finasteride or Proscar and dutasteride or Avodart actually do shrink the prostate over time. They work by blocking the specific hormone, a version of testosterone called DHT, that signals the prostate to keep growing. By cutting off that growth signal, the prostate slowly begins to reduce in size. The key word here is slowly. These medications are not a quick fix. It typically takes at least 3 to 6 months to see the full effect. This requires patience. But for men with a significantly enlarged prostate, the payoff can be huge. This is the only class of medication that can actually change the physical size of the prostate and potentially prevent the need for surgery down the road. A note on side effects. I want to be direct with you about this. All medications have potential side effects. With these prostate drugs, a small percentage of men may experience things like dizziness or sexual side effects, like decreased libido or erectile difficulties. This is why an honest, open conversation with your doctor is so important. Don't let fear of side effects you read about online prevent you from getting help that works. Your doctor can help you weigh the pros and cons for your specific situation. Sometimes a simple dose adjustment or trying a different medication in the same class can solve the problem. Remember, the goal is to improve your overall quality of life. Option 3. Modern, minimally invasive procedures. What if medications don't work well enough, or a man doesn't want to take a pill every day for the rest of his life? 50 years ago, the only other option was a major surgery, often with a long and difficult recovery. Today, things are completely different. We now have a range of minimally invasive procedures that can provide tremendous relief with much easier recovery times. For example, there are procedures like prostate artery embolization, where a doctor inserts tiny microscopic beads into the arteries that feed the prostate. This reduces the blood flow, and without that robust blood supply, the prostate naturally begins to shrink. The results are impressive, with over 90% of men getting significant relief in the first year. Other common procedures use water vapor, steam, or laser energy to remove the excess prostate tissue from the inside. These are often done as outpatient procedures, and the recovery is worlds faster than old-fashioned surgery. The point is this: you have options. Powerful, effective options. Your body hasn't failed you, it simply needs the right kind of modern support. Part 3. The Big Picture. A lifestyle for long-term health. We've talked about the best food. We've talked about proven medical treatments. Now let's put it all together. How do you build a life that supports your prostate and your overall health for the long haul? The Mediterranean way, more than a diet. Instead of obsessing over single miracle foods, the overwhelming body of research points to a complete eating pattern. The one that consistently comes out on top for prostate health is the Mediterranean diet. This isn't a restrictive, joyless diet. It's a way of life. It's rich in the things we know are good for us. A wide variety of colorful fruits and vegetables, not just one. Whole grains, healthy fats from olive oil and nuts, and lean protein from fish. It's also naturally low in the things that can increase inflammation throughout the body, like red meat and heavily processed foods. This makes perfect sense when you stop and think about it. Your prostate doesn't exist on an island. It's part of a complex, interconnected system. What's good for your heart, what's good for your brain, and what keeps your blood vessels healthy is also going to be good for your prostate. Simple lifestyle shifts that make a difference. Beyond food, a few common sense adjustments can have a real impact. Maintain a healthy weight. Research clearly shows that obesity makes BPH symptoms worse. Losing even a small amount of weight can reduce the pressure on your bladder and improve your symptoms. Move your body. You don't have to become a marathon runner. A brisk walk each day is enough. Regular physical activity improves circulation everywhere in your body, including down there. Time your water. Staying hydrated is important, but when you drink matters. Drink plenty of water throughout the day, but start to taper off a few hours before you go to bed. This simple trick can dramatically reduce how many times you have to get up at night. Don't hold it. In our busy lives, we sometimes delay going to the bathroom. When you feel the urge to go, go. Holding it in can overstretch your bladder and worsen your symptoms over time. Acknowledging the emotional weight. Finally, let's talk about something that often gets ignored in the doctor's office: the psychological toll of this condition. This isn't just a physical problem, it's an emotional one. When your sleep is constantly broken, you feel perpetually tired. When you can't trust your own body, your confidence takes a hit. Research has shown that men with severe BPH symptoms have higher rates of anxiety and even depression. It can affect your relationship with your partner. You might pull away from intimacy, not because you've stopped caring, but because you feel broken or ashamed. It can make you feel old before your time. It can rob you of your sense of vitality, your sense of being a capable man in the world. What you're feeling isn't weakness, it's feedback from a body that wants to come alive again. With the right support, it can. Your empowerment cue. You are not broken. I want you to hear this loud and clear. You are not broken. You're rebuilding. What you're experiencing is not a personal failure. It is a common, treatable medical condition. The vast majority of men will deal with this in their lifetime. There is no shame in it, and there is certainly no shame in asking for help. The man you were is still inside you. The strength, the confidence, the vitality. It hasn't disappeared. It simply needs to be restored. This isn't a decline. It's your body calling out for a new kind of support. You've spent your life showing up for others. Now it's time to show up for yourself. So here is the bottom line. Here is what I want you to take away today. Those viral videos about miracle fruits are selling you false hope. A healthy diet rich in a variety of vegetables and fruits is absolutely a good thing, but it's part of a bigger picture, not a quick fix. Proven, effective medical treatments exist, and they are the most powerful tools we have to give you back your quality of life. The men who do the best are the ones who create a team. They eat well, they stay active, and they work in partnership with their doctor to find the right medical solution for them. Your prostate problems didn't happen overnight, and they won't be solved overnight. But with a smart, realistic, and comprehensive approach, you absolutely can take back control, sleep through the night again, and feel like yourself as you age. Getting older doesn't mean giving up. It means getting smarter. I want you to think about something. What would it mean to you to feel like yourself again? To not have to plan your day around where the next bathroom is? To sleep soundly through the night? Let me know in the comments below. We read every one. If this conversation was helpful, please subscribe to ElderCare Insights for more honest, empowering health advice from someone who respects where you are. And remember, the information we discuss here is meant to educate and empower you. It is not a substitute for a one-on-one relationship with your personal health care provider. Please always talk to your doctor before starting or stopping any treatment. Start today. Not for the man you were, but for the man you still are.